Okay, welcome. Um, I'll be presenting the app prep presentation today on asking and collecting letters of recommendations. This workshop will be recorded, so if you would like to turn on your cameras or not, that is completely fine with me. Just as an introduction of myself, I am Karen Yanes. I am a staff advisor at Health Professions Advising. I also help plan the pre-health conference at UC Davis. I'll be presenting today's workshop on asking and collecting letters of recommendations. We'll be going over a lot of things today, such as how to collect them, general recommendations, general requirements, et cetera, et cetera. So let's go ahead and get started. All right. This is what we will be discussing today. As I mentioned before, we will be going over what types of letters HPA recommends. So this is like our general recommendations, general requirements for your letters of recommendation, what a timeline looks like, how to ask for those letters, what is a letter packet, and how to collect those letters. All right. These are general recommendations. Again, this is what HPA recommends. In the next slide, I have kind of like a few examples of what schools might actually be asking for, but kind of just as a general idea of like the types of letters that you should be asking for. So for general requirements, we typically recommend two sciences, so two science professors, one non-science professor. This could be like a professor you might have taken for like humanities or social science, maybe like a writing class. One non-academic. This non-academic can be like a volunteer opportunity or a job or someone who can speak to your abilities. And one physician. This goes like an MD or DO or vet, PA, dentist, depending on your health profession. I have heard that if you are interested in like applying for DO, then you must have a letter from DO and not MD. But these are like, again, general requirements, and these specific requirements can vary by school. Sorry, I have a little bit of a cough today. Some sites, like some of the CASs, like the application sites, like have like I know like AMCAS can let you upload up to 10 letters. Doesn't mean that you have to get 10 letters. It just means that you can like upload up to 10 letters. And with AMCAS, you can decide which schools you want to get those letters. Like that schools have like specific requirements. So if a school wants 3 science letters, for example, then you can just submit 3 letters for that specific school. I think a COMAS allows up to 6. And then I'm not exactly sure of like all the other ones, but that is something that you would need to also like investigate as well. I think most other allow up to 4 that go to every school. In the bottom, I have like what is a committee letter. I think this is probably like something that you all have heard of as well. A committee letter is typically done by a program. Like such example is like a postbac program. A committee letter can also be known as a composite letter. For example, like HPA has like their own postbac program, and our postbac program does what's called a composite letter. Basically like the first page of your committee letter has like a summary of like the letters that are to come. Um, and then has like all of your other letters in like one packet. So that is basically what a committee letter is. I think it can vary, the definition can vary also by like program or school. But this committee letter, it should never be required. Um, some schools say like we either require you to submit a committee letter or 5 letters of recommendation or something like that. But it should never be required. Um, UC Davis does not offer a committee letter. And applications would say you can either submit a committee letter or a required number of letter recommendations. This is what I was talking about like in the previous slide. These are just like some general examples, a few examples of like popular programs that I see students applying to. these are actually pretty accurate. I pulled this information very, very recently. I also tried to include a variety of health professional schools also. So like, for example, UC Davis School of Medicine, they want 3 to 6 letters of recommendation. One from a physician is recommended. And usually when it says recommended, it's because they want you to get that letter of recommendation. I have an osteopathic school, Toro, wants 2 science professors, 1 from physician. Samuel Merritt PA program wants 3 letters, 1 from a physician or PA is preferred. So again, like what I was talking in like the previous slide, that some health professions like DO want you to submit a specific letter from a DO. UCSF dentistry, 3 letters, 1 science, 1 dentist, 1 personal choice. Depending on which letters you want to ask for and who you're thinking of asking for a letter of recommendation. I always encourage like looking into the school's websites, because that is going to tell you like the most accurate information and what letters you would need to ask for. Requirements for your letter of recommendation. For your requirements, the letterhead, it must have an official letterhead. I did include 2 pictures here of a few examples that we have used. I think the one on the top, the one right here is like outdated. And we use like the one on the bottom for like HPA wise. But the letterhead is what goes like on the header of the page to make it look like more official, make it look like it's coming like from an actual like company or institution or something like that. You need to remind your letter writers that they need to use the letterhead, because I have seen like I help with the composite letters for the postgrad program, so I have seen that sometimes people forget to include the letterhead and just like something like just a Google Doc or something like that. So it is very, very important to include a letterhead just to make your letter look a little bit more official. And then your letter should also be signed. A simple text with the name and title of the person, like in text format, is not going to be enough. Like a simple sincerely with name on it is not going to be enough. You're going to have it signed. Because then they won't be able to actually like make sure it's accurate. So again, you need to remind them that they need to include their signature as well as their name and title in text format. And then they must have an official letterhead. And then you can always include all of this information when you reach out to your letter writers as well. For your timeline, there isn't really an official timeline for letters of recommendations. Like I wanted to include like dates and such like in this slide, but I realized that there isn't really an accurate timeline for letters of recommendation. I will say that ultimately it depends on when you plan on applying and your application dates. Um, I'm like mostly familiar with like the pre-med application timeline, but it just really depends on like when you plan on applying. Like there are different applications, like the different like CASs for each health profession that have like different application dates. Like nursing is a good example because some of those might not always occur, or the submitting of the applications may not always occur in the summer. Number 1 is to get familiar with your application dates. So the opening date, the deadlines, application verification, and your secondary timeline. Sometimes your letters of recommendations might not actually be due by like the application deadline, but instead like your secondary or your letters of recommendation must be submitted by your secondary applications. So that is something to be familiar about, and investigate if that is something that you need to do for your required applications. Number 2, reach out to your letter writers. The earlier, the better. I will be going into more detail about this one, but I do want to say as a general rule of thumb, give them 2 to 3 months to write the letter. And 3, follow up and thank them for their time. That is after you see that they have submitted the letter into your application. Sometimes you do receive a notification Actually, you should receive a notification once they submit the letter onto your application. Just go ahead and follow up and thank them for their time because they did spend a bit of time working on this. I also like generally recommend like asking your letter writers maybe like 6 months before your application is due. Um, Especially if it's like for like health professions that you know is going to be very popular and they're going to be receiving like a lot of requests. Maybe like 6 months, maybe like if you're interested in going to medical school, like around this time is perfect to ask for a letter of recommendation. Well, again, most applications tend to open up in the summer. Some might open at different points of year. And yeah, right. How to ask. The goal is to ask them in person. I think that's always the goal. Sometimes it might be hard to ask them in person because professors have like a tough schedule and we know professors. So, or sometimes you're out in the area, you're an alumni, right? And you don't really have access to go to them in person. That is also another situation. But the goal is to ask them in person. That way, if they say yes, you'll be able to give them your letter packet directly. And I'll also be going more into the letter packet as well. You can also answer any questions they have about the letter packet if they decide to review the letter packet, like right there in front of you in that in-person meeting that you have with them. Email is fine. That is like if you have moved away from Davis and really don't have like the resources or anything to come back to Davis just to meet with the professor, then email is fine. But an even better idea is to start with an email and perhaps schedule a Zoom meeting to discuss your letter of recommendation if you are in the situation. Again, if they say yes, you can follow up in an email, thank them for their time. And also like you can also follow up in an email with your letter packet since you can't give your letter packet to them in person. Make sure you are asking early. As mentioned earlier, preferably like 6 months in advance, but you want to give them like 2 to 3 months to write the letter. There are different like scenarios that can happen. Like for example, let's say you want to ask a letter writer who you took the class like 2 years ago, right? That's and you got like an A in the class and you feel like this person can really speak to your abilities. That is good. That is a great idea. Definitely ask for the letter. I would say it is an even better idea if you have maintained contact with this professor because they've probably seen hundreds and hundreds of students. Um, that's very important to just continue maintaining contact. If you're currently taking a class but maybe don't plan on applying in like let's say 2 years, ask either way. You can ask either way while they still know you. Again, you have to continue maintaining contact with that professor. Um, they can either decide, or you can also decide, you can like let them know that they can write the letter now and turn it in when you are ready to apply. Or another option is that you can ask them like now when they still know you, continue maintaining contact, and they can write the letter during your application cycle. So let's say if you're if you're planning on applying in the summer, you might want to ask them around now if they can write you the letter right now. I think like the date on the letter of recommendation is also important. So like if you don't applying in 2 years and you plan on asking like someone right now, then just keeping in mind that that date has to be changed. So that date has to be more recent. Storing your letters of recommendation is a different conversation. I will be going over how to store those letters of recommendation. I'm sure some of you have heard of Interfolio. So I'll be talking also a little bit about Interfolio. Yeah. Some examples of who you can ask for a letter of recommendation. Community college is good, but also have someone from a 4-year. If you are a transfer student, then of course you might have some really good recommendations from community colleges. And also community colleges do have like smaller class sizes, so the professor might actually like remember you a little bit more clearly. The community college is definitely not a bad idea, but again, also have someone that you've taken here at Davis. TAs are also great. TAs are also a really good idea. It's even better if TAs co-sign that letter with the professor you actually took them with. So go ahead and ask, like if you are thinking of a TA, like sometimes with TAs, they're the ones who hold the discussions and stuff like that. So they might know you better, or you might have had like better interactions with the TA than you have had with the professor. So again, TAs are a good idea, but make sure that letter is co-signed by the professor as well. Someone who left UC Davis, this one is also okay if they left UCD, but you must remain in contact. So if they're planning on leaving UC Davis, and maybe they've told you, maybe they haven't, like you probably have to have like some kind of way to get or reach them out without their UC Davis email. So it's very important to remain in contact, and it could be tricky if they don't have the ability to put like the letterhead. However, they might have like their own private practice and they could possibly use that letterhead as well. A professor who you took a class with a long time ago, I already talked a little bit about this one, but again, maintaining contact is super, super important when asking for these letters of recommendations. You can either ask them to write the letter right now and store it until you are ready to apply, or you can ask the professor to write the letter when you are ready to apply, but you just have to, again, maintain that contact. Okay. Competencies. Each health profession has like competencies. So you need to be familiar with the competencies that are expected, and you need to kind of figure out who do you know that can comment on the competencies. Like such competencies that are very popular, like customer service or cultural humility. Um, Teamwork is also another one. So think of people not only from like professors, but also think of like any like extracurriculars that you've had who can speak on the competencies that are desired by or required by your desired health profession. This is just an example. I did use like the AAMC medical school example. But such things like professional competencies, science competencies, thinking and reasoning competencies. Like for science competencies, you might be thinking like, oh, professor can speak on how well I did on human behavior or something like that. Maybe for that extracurriculars, like you can think, oh, service orientation, adaptability, interpersonal skills, and things like that. So you really want to look at these competencies and think of those letter writers that who can speak on your abilities to do like some of these competencies. It doesn't like you don't have to like cover each and every single one of them in your letters of recommendations, but make sure you are at least thinking about these competencies when asking your letter writers, and even like asking them if they can write on how you have demonstrated X competency in their class or in that volunteer opportunity that you've had. Okay, letter packet. This letter packet will be something that you will either hand in person to that letter writer, or if you don't have the ability to be there in person, then the letter packet is something that you can email to your letter writer so they can go ahead and review. For your letter packet, you want to include the cover letter. The cover letter is basically an invite for them to, or a request for them to write you a letter of recommendation. This request can include like who you are, when you took their class, or when you took this opportunity slash extracurricular, etc. Some information on like why you want them to write the letter of recommendation, and then at the end just kind of say like if you are interested in writing my letter of recommendation, please let me know. And sometimes it's okay. Sometimes you're going to receive no's, and that is completely fine. When you receive no's, then that just means that you can move on to somebody else. And it's going to happen, and that's completely fine. I think it might be frustrating sometimes, but that is why we want to start right now before it's too late. For attachments, you want to include a draft of your personal statement. With your personal statement, that is again why it's also very important to start writing that early. It doesn't have to be your final draft, but it also doesn't have to be your first draft. You do want to have it reviewed a little bit before you send it to your letter writers. And that's what HPA is here for as well. Like, you can always come to us to review your personal statement or even see if it's ready to submit to your letter writers as well. But have a draft of your personal statement ready to send to your letter writers so they can get to know a little bit more about you and your story. A resume is also very helpful so they can see what are the different extracurriculars or jobs, volunteer opportunities, internships, etc., that you have been involved in. And that also gives them an idea of like why you want to enter this health profession. That could also be something they could talk a little bit about in your letter of recommendation if they desire. Your transcript, if you are comfortable, but your transcript will show that, for professors at least, will show that yes, you actually took that class in said semester that you said you did, and you actually received the set grade you said you did and everything. Same goes for extracurriculars, like like you can, the supervisor or whoever, your PI or whoever you plan on asking for a recommendation from can see that you've been a good student, you have demonstrated an upward trend, you have shown improvement. So your transcript is optional. That is only if you are comfortable. And letter writer guide. This letter writer guide is not available for all CASs. The CIS application systems is not available for all of them. Medical school does have one. I think it's like a quick Google search, like AMCAS or ACOMAS letter writer's guide. And that could be helpful for the letter writers if they don't know about it already, but that also has some good information. And I'm sure that also has some pretty good information for like other health professions as well. But if there is a letter writer guide for your desired health profession, just go ahead and send that to them in this packet as well. Apart from all of the attachments include directions. For example, where do they submit this letter of recommendation? By when do they have to submit this letter of recommendation? Where to submit it, that could be Interfolio, which is actually in the next slide. Or if you are already in the application cycle, then whenever the application opens for your desired health profession, then you can already start and putting like everyone's names if they say yes. And then that's when they're going to receive like a link or something like personalized, like a code or something where they can submit that letter directly to your application. And then by when to submit it, make sure you give them a deadline, because if you don't give them a deadline, they're just gonna go past their head. Yeah. Selecting your letters of recommendations. Interfolio, I have mentioned Interfolio quite a few times. Interfolio is a really good website to store your letters of recommendation. However, not all applications accept Interfolio. If they do, great. If they don't, then that means that you can either ask for the letter to be written when you are still familiar with the letter writer, or you can ask when it's getting closer to apply, but you have to continue maintaining that relationship with your letter writer. But with Interfolio, you can collect your recommendations in advance, and then you can store them until you are ready to apply. There is like something specific on the application that just lets you upload all of the letters from Interfolio directly. So it is a really, really great website. I do wish that all of the application systems use Interfolio, because it is really good to just store them and just have them ready when you are ready to apply. But unfortunately, that is not the case. The only thing I would like you to be aware of is like the date that is on the letter of recommendation. Like if you know there's like a letter in your Interfolio that was written 2 years ago, then it'd probably be important to either follow up with your letter writer to make sure that the date is not in 2021 or something like that. Um, or you can like already ask your letter writer when it's recent to like include the date to be somewhere like in 2024 or 2026 or whenever it is that you plan on applying. If they feel comfortable with that, great. If they don't, then we can just reach out back to them when you are ready to apply and ask them to update the date. In the application, I already mentioned this, but there is like a specific part in your application. Sometimes letters of recommendations are also known as evaluations in the application. So look for evaluations or letters of recommendation or something relating to letters in your application, because that is an area where you're going to like tell your letter writers, here is where you can submit your application. I received a question. Let me see. If you're planning to apply this year, is there any advantage to using Interfolio, or is it mainly to use it if you're applying in the future? There's definitely an advantage to using Interfolio, or I wouldn't say an advantage, but if you just want to use it as a way to store your letters of recommendation before the application even opens, then yes, I encourage using Interfolio. If you just want to let your letter writers know right now, um, and then just send them the link to upload the letter directly onto the application, then that is also something that you can do. I forget exactly when AMCAS opens their application, but once it opens, that is when you can send the link. How do you know if a program accepts Interfolio or not? Great question. So it says on yeah, no problem, Jocelyn. So like it says like directly on like the websites of like the application systems. So AMCAS uses Interfolio, ACOMAS uses Interfolio, but some other ones like I think Nursing CAS will not use Interfolio. I don't think CASPA uses Interfolio either. I am not familiar with PTCAS, OTCAS, and all of the other ones for like the other health professions, but that's why it's important to look. Sometimes it already says already on the like on their websites, on their liaison websites, if they accept Interfolio or not. If they don't say anything about using Interfolio, then that means they don't. No problem. All right. The next point is to never collect it in person. That is a pretty bad idea because this is kind of like a confidentiality issue. There's also like kind of if you are familiar with like submitting like your letters of recommendation request, then sometimes it asks you to if you would like to waive your right to view this letter. Um, you should always click yes, you want to waive your right to view this letter. That gives like your letter writers the liberty to write like something about you. Like if you want to like ask them for what they asked, what they are going to include in the letter maybe after the application process. And yes, if you feel comfortable doing that, that is something you can. But usually it's always a good idea to waive your right to view the letter of recommendation. So never collect it in person. And then the last point is writing your own letter, question mark. So writing your own letter, it's not uncommon. Maybe you're going to be asked to write your own letter. Maybe you won't. But in this situation, you need to be prepared on what you decide to do. Our recommendation is to not do it, but again, it's like a personal choice. You have to know like what you decide to do and maybe even your own personal workload if that is something that you can do. But if you are not comfortable doing that, then you can just let them know you're not comfortable writing your own letter and just decide to move on to another writer. Sometimes people do this just because it makes it easier for them. And also because they have a lot of work to do and everything. So maybe you can just write the letter and they can just like sign it off at the end. But if this is like something that you don't feel comfortable doing, then just move on. Don't waste your time also like writing your own letter. But again, personal choice. If that is something you want to do, you have to just evaluate the situation. Final tips. Be genuine and authentic, be present and engaged, and don't be afraid. Um, there are going to be many, many students that are going to be asking for letters of recommendation. And I'm sure professors and your supervisors or PIs or anybody that you have worked with have been asked for a letter of recommendation in the past. So they're probably already used to these situations also. And like my biggest piece of advice, don't be afraid to ask for a letter of recommendation. Even if you think like this professor or this person might not remember you, it's still worth a shot. So don't be afraid. That wraps up the presentation on asking and collecting letters of recommendations. We do have a few minutes left, and let me just check the chat to see if we have any questions. All right, question from Corey. Some schools are asking for the letters of recommendations to be sent directly from the recommender from their UC Davis email, or the school has a completely online submission. How is the recommender going to add the letterhead? Are they going to send a scan of the signed letter? Let's see. Let me just reread the question. Um, for this question, I think, yep, thank you, Alex. For this question, I think that's probably going to like me like a conversation with your letter writer to see if they are even able to provide the letterhead. Um, so Corey, is this someone who has already left UC Davis and they don't have access to the letterhead? Okay, so if it's a current UC Davis professor, then they should already have access to the letterhead. And if the school has a completely online submission, then like usually in those situations you can just like send them the link to upload the letter of recommendation directly. Does that answer your question? All right, yeah, no problem. Any other questions? Yeah, thank you for joining. All right, if there are no other questions, thank you everyone for joining the session today. I'll go ahead and stop the recording. And HPA is here to help. Let us know if you have any other questions.